A few months ago, I sat down with a patient named Gloria. She's 71, retired school teacher, grandmother to 4 kids who, according to her, eat too much sugar. Gloria came to me with a folder full of lab results and a question I hear often. "Dr. Miller, is there anything I can do on my own? Something simple? Something that might actually help?" Now, I've been a cardiologist for 25 years. I've treated over 15,000 heart patients. And what many people don't realize is that heart health and kidney health are deeply connected. When kidneys struggle, the heart works harder. When the heart struggles, kidneys feel the strain. They're partners in this. So Gloria's question mattered to me, and my answer surprised her. "Yes," I told her, "there are a few things, and some of them might already be in your kitchen." Today I want to share with you what I shared with Gloria. 8 natural drinks that research suggests may help support kidney function. Not miracle cures, not replacements for medical care. Just simple, practical options that might complement what you're already doing. Let's walk through them together. Before we get into the specific drinks, I want to be clear about something. Your kidneys are remarkable organs. Each one is about the size of your fist, and together they filter roughly 200 liters of blood every single day. They remove waste, balance fluids, and help regulate blood pressure. When they're healthy, you barely notice them working. When they're not, things can become more complicated. Over 2 million people worldwide currently rely on dialysis. That's a treatment where a machine does the filtering work that kidneys can no longer manage on their own. For some people, dialysis becomes necessary. And if it does, it's not a failure. It's a treatment that keeps people alive. But for many others, there are steps that may help slow the progression of kidney concerns. Diet is one of those steps. Hydration is another. The drinks we'll discuss today fall into that category, things that may offer gentle support. Here's what I always tell my patients, though. These suggestions work best alongside your regular medical care, not instead of it. If you're taking medication, keep taking it as prescribed. If you have kidney disease, work closely with your nephrologist or primary care doctor. Before making significant changes to your diet, check with your healthcare team. This isn't about going it alone. It's about adding helpful habits to the foundation of care you already have. Make sense? Good. Let's start with something you've probably had before. Gloria loved apples. She told me she'd been eating them since childhood. What she didn't know was that apple juice might be doing her kidneys a quiet favor. Let me explain it this way. Think of your kidneys like a coffee filter. Every day they're catching waste particles and letting the good stuff through. Now, if that filter gets clogged with mineral buildup, things slow down. Flow decreases. Problems can develop. Kidney stones are essentially mineral clogs. They form when certain substances in urine become too concentrated. Here's where apples come in. One small study looked at 9 healthy women who drank 2 to 4 cups of apple juice daily for 5 days. The results showed changes in their urine chemistry that suggested a lower likelihood of forming certain types of stones. It's not definitive proof, but it's interesting. Apples also contain compounds called phytochemicals, along with vitamin C and a fiber called pectin. These may help with what scientists call oxidative stress, which is essentially cellular wear and tear. Now, here's the practical part. If you want to try this, fresh is better than store-bought. Many commercial apple juices contain added sugars, which can spike blood glucose. That's particularly concerning if you have diabetes, which is one of the leading causes of kidney problems. So consider juicing your own apples at home, organic when possible, and drink it in the morning on an empty stomach for better absorption. One more option: apple cider vinegar. Some people find it helpful for digestion and blood sugar balance. If you try it, start small. 1 to 2 tablespoons mixed with water. See how your body responds. Here's something that puzzled researchers for a while. Why do some people get urinary tract infections over and over, while others almost never do? Turns out, part of the answer involves bacteria and how well they can stick to the walls of your urinary tract. Cranberries contain compounds called procyanidins. These create a kind of protective coating that makes it harder for bacteria to grab hold and cause infection. This matters for kidney health because urinary infections that travel upward can reach the kidneys. Repeated kidney infections leave damage behind. Over time, that damage adds up. So preventing infections in the first place is a form of kidney protection. But that's not the only benefit cranberry juice offers. There's also evidence it may help with blood pressure, which is one of the most significant factors in kidney health. When blood pressure runs high, it damages the tiny filtering structures inside your kidneys. That damage accumulates over years. Keeping pressure in a healthy range helps preserve kidney function. Now, a word of balance. Cranberry juice may prevent some types of kidney stones, but for other types, particularly those made of oxalate or uric acid, it might actually increase risk slightly. So moderation matters. Aim for about 120 to 240 milliliters daily. That's roughly half a cup to 1 cup. Choose 100% pure, unsweetened varieties. Cranberry cocktails are mostly sugar with minimal actual juice. And if you take blood thinners like warfarin, talk to your doctor first. Cranberries can interact with that medication. One of my patients, a retired postal worker named Harold, drinks a small glass every evening with dinner. He calls it his kidney insurance. I appreciate the sentiment, even if I'd describe it more modestly as kidney support. Okay, I'll admit something. Beet juice isn't the most popular recommendation I make. The taste takes some getting used to. But the research caught my attention. Here's what happens inside your body when you drink beet juice, step by step. Beets contain inorganic nitrate. When you consume it, your body converts it into nitric oxide. This compound helps relax blood vessels, improving circulation and reducing the pressure inside them. Less pressure on blood vessels means less pressure on kidneys. In a clinical study involving 60 adults with kidney disease, researchers found that beet juice improved blood vessel function and reduced blood pressure. For people whose kidneys are already working hard, this kind of support matters. Making beet juice at home is straightforward. Cut beet roots into chunks and run them through a juicer. No juicer? Blend with water and strain through a mesh strainer. To improve the taste, add a small piece of ginger or half an apple. The sweetness helps balance the earthy flavor. If you find it too strong, dilute it with apple juice or add a few drops of lemon. The best time to drink it is morning, about 30 minutes before breakfast, or use it as an afternoon pick-me-up. 1 glass, about 150 to 200 milliliters daily, brings benefits. If daily isn't realistic, 2 to 3 times weekly still helps. One caution: beets contain oxalates, which can contribute to certain types of kidney stones in people who are prone to them. If you have a history of stones, talk to your doctor first. And don't be alarmed if your urine turns pinkish after drinking beet juice. That's just natural pigments passing through, completely harmless. It's called beeturia, and it startles a lot of people, but it's nothing to worry about. Here's an analogy I use with patients. Imagine tiny crystals forming in a bucket of water. Left alone, those crystals stick together and grow larger. Eventually, you've got a rock sitting at the bottom of the bucket. That's essentially what happens with kidney stones. Minerals in your urine crystallize and clump together. Now imagine adding something to that water that prevents the crystals from sticking. They stay small. They wash away easily. No rock forms. That's what citric acid does, and lemons are packed with it. Research suggests that consuming the juice of about 2 lemons daily, or half a cup of lemon juice concentrate mixed with water, can raise citrate levels in urine and potentially lower kidney stone risk. In one study involving 203 patients with a history of calcium oxalate stones, half received lemon juice twice daily. After 2 years, the lemon juice group had fewer stone recurrences than those who didn't take it. That's meaningful. Using lemon juice is about as simple as it gets. Start your morning with warm water and juice from half a lemon. Drink it on an empty stomach about 20 to 30 minutes before breakfast. This habit supports not just your kidneys, but your digestion as well. If you find the sourness too intense, add a little honey or some fresh mint leaves. And if you have heartburn or a sensitive stomach, dilute it more or have it after a light snack. One tip: use fresh lemons, not bottled juice with preservatives and added sugars. And consider using a straw to protect your tooth enamel, or rinse your mouth with plain water afterward. Small habit, easy to maintain, potentially helpful for your kidneys. Lime is lemon's cousin, and it works in similar ways. Like lemon, lime is rich in citrate, that same compound that helps prevent crystals from clumping together in your urine. The Cochrane Database of Systematic Reviews, which is considered a gold standard in medical research, found evidence that citrate effectively helps manage kidney stone size. For people with recurring stones, this could mean avoiding progressive kidney damage over time. Here's something practical. Lime juice provides vitamin C and beneficial plant compounds without excessive potassium. That balance matters for people whose kidneys have reduced function, because potassium regulation becomes more difficult as kidneys decline. Using lime is simple. Make limeade by mixing lime juice with water and minimal sweetener. Add lime to salads, marinades, or fish dishes. 1 medium lime daily provides a meaningful amount of vitamin C and kidney-supporting nutrients. Prefer something less acidic? Mix lime juice with unsweetened coconut water. The combination reduces tartness while adding electrolytes. Try this recipe. Juice from 1 lime plus 200 milliliters of unsweetened coconut water. Add mint leaves or ginger slices for extra flavor. Refreshing and potentially helpful. I want to be straightforward with you about this one. Celery juice has become quite popular in recent years. You've probably seen it on social media or heard people talking about its benefits. Some of those claims are overblown, but some have genuine merit. Here's what we know. Celery contains a flavonoid called Apigenin. Research suggests this compound may help protect cells from certain types of damage and reduce inflammation. Celery also has natural properties that may support healthy blood pressure levels. Since high blood pressure is one of the leading causes of kidney damage worldwide, anything that helps maintain healthy pressure is worth considering. However, and this is important, human research specifically showing that celery juice cleanses kidneys is limited. The claims you hear sometimes outpace the evidence. What I can say is this: celery is a low-potassium vegetable with decent nutritional value. For people watching their kidney health, it's a reasonable choice to include in their diet. If you want to try celery juice, here's how. Cut celery stalks into small pieces and blend with water until smooth. Strain if you prefer no pulp. Enjoy immediately for maximum freshness. For variety, add ginger, cucumber, fresh mint, or lemon juice. If you don't love celery's distinctive taste, mix half a cup of celery juice with apple or cucumber juice. The sweetness or freshness masks the intensity while preserving benefits. Drink it on an empty stomach if that works for you. Start with about 100 milliliters and increase gradually as your body adjusts. One note: if you take blood thinners, check with your doctor. Celery contains vitamin K, which affects blood clotting. Picture this. Your kidneys are like a gentle stream, constantly flowing, carrying waste downstream and away from your body. When that stream runs low on water, flow slows. Sediment settles. Things get stuck. Dehydration is one of the simplest ways kidney health declines, and cucumber juice is one of the simplest ways to stay well hydrated. Cucumbers are 96% water. That's remarkable. Beyond hydration, they contain vitamins, minerals, and compounds that support cellular health. They work like a gentle broom, helping the body clear waste naturally. For people concerned about kidney stones, cucumber's high water content may help dilute urine and reduce stone formation risk. Making cucumber juice is easy. Wash 1 to 2 medium cucumbers. Leave the skin on if they're organic. That's where many nutrients are. Cut into chunks and blend with minimal water. Enhance the flavor with ginger, mint, or lemon. Find it too bland? Mix with apple or berries for natural sweetness without added sugar. Another option: cucumber with lime and cilantro creates a refreshing drink with a bit more character. Store cucumber juice in a glass container in the refrigerator and try to consume it within 24 hours. The nutrients start to degrade quickly after juicing. If you make extra, freeze it in ice cube trays. Then you can add refreshing cucumber cubes to your water throughout the day. Especially nice in summer. Let me tell you something interesting about pineapple. Chefs have known for centuries that pineapple tenderizes meat. You put a tough cut of beef in pineapple juice, and it softens. That's because of an enzyme called bromelain. Inside your body, bromelain does something different but equally useful. It helps reduce inflammation. Inflammation is like a low-grade fire burning inside your body. It's connected to joint pain, heart disease, and yes, kidney problems. Chronic inflammation can worsen outcomes for people with kidney concerns. Bromelain helps calm that fire. It targets inflammatory compounds and promotes a more balanced internal environment. Pineapple also offers vitamin C, manganese, and fiber. And here's something that matters for people watching their kidneys. Pineapple has lower potassium levels than many other fruits. As kidney function declines, managing potassium becomes more important. Pineapple lets you enjoy a sweet, tropical fruit without excessive potassium intake. To make fresh pineapple juice, cut 1 medium-ripe pineapple into chunks and blend until smooth. Add water if needed. For extra benefit, add fresh ginger or mint. A reasonable serving is 4 to 6 ounces, around 120 to 180 milliliters daily. Morning or midday works well. Concerned about sugar content? Dilute with water or cucumber juice. Or try frozen pineapple chunks blended with coconut water for a smoothie. One caution: bromelain can have a mild blood-thinning effect. If you take anticoagulants or have surgery coming up, check with your healthcare provider first. Now, I want to take a moment to talk about something important. You might have heard the term kidney cleanse or kidney detox. It sounds appealing. Who wouldn't want clean, fresh, functioning kidneys? But here's what I want you to understand. Scientific evidence supporting dramatic kidney detoxification is limited. And more concerning, while gentle dietary changes might be helpful for healthy kidneys, aggressive cleansing protocols can pose real risks for kidneys that are already compromised. Some cleansing programs involve fasting, severe calorie restriction, or bowel preparations. These can cause electrolyte imbalances, dehydration, and in some cases, dangerous shifts in blood chemistry. That's the opposite of helping your kidneys. So please, if you're interested in supporting your kidney health, approach it gently. The drinks we've discussed today are not aggressive interventions. They're moderate, food-based options that may offer support. If you have known kidney disease, the approach becomes even more important. Work closely with your healthcare team. Consider established kidney protective eating patterns like the renal diet or the DASH diet, which emphasizes fruits, vegetables, whole grains, and limited sodium. The National Kidney Foundation recommends DASH to help slow kidney disease progression. It's evidence-based and well-studied. The key principle is moderation and consistency. Gentle, sustained support does more than occasional dramatic measures. And please remember, if you're taking medications, keep taking them as prescribed. If something in this video interests you, talk to your doctor or nephrologist before making changes. This information complements medical care. It doesn't replace it. Before we wrap up, I want you to know when to seek immediate medical attention. If you experience severe pain in your back or side, especially with nausea or vomiting, that could indicate a kidney stone or other urgent issue. If you notice blood in your urine, or if your urine output drops significantly, contact your doctor promptly. If you experience sudden swelling in your legs, ankles, or face, along with fatigue and difficulty breathing, those could be signs of kidney problems requiring immediate evaluation. These symptoms don't always mean something serious, but they deserve professional assessment. When in doubt, call your doctor. If symptoms are severe, go to the emergency room or call 911. Your kidneys deserve attention, and so do you. So here we are. 8 drinks. Simple options that may offer some support to organs that work tirelessly on your behalf. Apple juice for hydration and potential stone prevention. Cranberry for infection protection and blood pressure support. Beet juice for blood vessel relaxation. Lemon and lime for citrate and stone prevention. Celery and cucumber for gentle hydration and nutrition. And pineapple for its anti-inflammatory properties. None of these are miracle solutions. Medicine rarely works that way. But together, as part of a lifestyle that includes proper medical care, reasonable eating habits, and attention to your body's signals, they might help. Remember Gloria from the beginning? She started adding lemon water to her mornings, a small glass of cranberry juice with lunch, cucumber water in the afternoon. Nothing dramatic, just consistent. Her last labs showed stable kidney function. Her doctor was pleased. More importantly, Gloria felt like she was doing something proactive for her own health. That sense of agency matters. If you found this helpful, consider subscribing. We share content like this regularly, always focused on practical, evidence-informed approaches to health. And if someone you care about might benefit from this information, feel free to pass it along. Thank you for spending this time with me. I appreciate your trust. Take good care of yourself, and take good care of those kidneys. I'll see you in the next one.